Coronary artery disease, often called CAD, is a common heart condition. It affects the major blood vessels that supply your heart muscle. These vessels are known as coronary arteries. Think of these arteries as the heart's vital delivery system. They are responsible for bringing oxygen-rich blood and essential nutrients directly to the heart muscle itself. This constant supply is crucial for the heart to function properly and pump blood to the rest of your body. In CAD, a problem develops within these important arteries. They begin to become narrowed over time. In some cases, they can even become completely blocked. When the coronary arteries are narrowed or blocked, the heart muscle doesn't receive enough blood. This means it doesn't get the oxygen and nutrients it needs to work efficiently. This insufficient supply can lead to various problems for the heart's health and function. Understanding CAD is the first step in managing it. It's a condition that develops gradually, and knowing what it is helps you understand its impact on your health. A main reason coronary arteries become narrowed or blocked is due to something called plaque. Plaque is a sticky substance that builds up inside the artery walls. It's not something that happens overnight. Plaque is made up of several different things. It includes cholesterol, which is a type of fat found in your blood. It also contains other fats, calcium, and various substances circulating in your bloodstream. Over many years, this plaque slowly accumulates within the inner lining of the coronary arteries. As more plaque builds up, it starts to take up space inside the artery. This reduces the open area available for blood to flow through. As the plaque continues to grow, it can also harden. This hardening and narrowing process is known medically as atherosclerosis. Atherosclerosis is the underlying disease process that causes CAD. You can imagine this process like a water pipe in your home. Over time, mineral deposits and other gunk can build up inside the pipe walls. This buildup makes the inside of the pipe narrower, making it harder for water to flow freely. Atherosclerosis does the same thing to your arteries, restricting blood flow to your heart. As the coronary arteries become narrower due to plaque buildup, the heart muscle may not receive enough blood flow. This is especially true when the heart needs more oxygen than usual. The demand for oxygen increases during physical activity, like exercising or walking uphill. It also increases during times of emotional stress. When the heart muscle doesn't get enough oxygen during these times of increased demand, it can signal distress. This distress often manifests as chest pain or discomfort. This specific type of chest pain associated with CAD is called angina. Angina is a key symptom of CAD. People describe angina in different ways. It often feels like a squeezing sensation in the chest. It can also feel like pressure or tightness in the chest area. Some people describe it as a heavy feeling. The discomfort of angina isn't always limited to the chest. The pain or pressure can sometimes spread or radiate to other parts of the body. It might be felt in the left arm, although it can occur in either arm. It can also radiate up into the jaw, the neck, or even the back. Angina is an important warning sign. It tells you that your heart muscle is not receiving enough oxygen-rich blood, particularly when it's working harder. Recognizing angina is crucial because it indicates the presence of underlying CAD. It's a signal that your heart's blood supply is compromised. While angina is a warning sign of reduced blood flow, CAD can lead to a much more serious event, a heart attack. A heart attack occurs when blood flow to a part of the heart muscle is completely cut off. This usually happens suddenly. The most common cause of a heart attack in someone with CAD is related to the plaque buildup. Sometimes, the surface of the plaque inside an artery can rupture or break open. When this happens, the body's natural healing response is triggered. This response involves the formation of a blood clot at the site of the ruptured plaque. This blood clot is the body's attempt to repair the damage. However, in a narrowed artery, this clot can quickly grow large enough to completely block the artery. A complete blockage means that blood flow to the portion of the heart muscle supplied by that artery stops entirely. Without blood, that part of the heart muscle is deprived of oxygen and nutrients. If the blockage isn't quickly cleared, the heart muscle cells begin to die. This event, where blood flow is completely blocked and heart muscle is damaged, is what we call a heart attack. A heart attack is a medical emergency requiring immediate attention. The longer blood flow is blocked, the more permanent damage can occur to the heart muscle. Prompt treatment is essential to restore blood flow and minimize damage. Certain factors increase a person's likelihood of developing coronary artery disease. These are known as risk factors. While some risk factors cannot be changed, many are related to lifestyle and can be managed. One major risk factor is high blood pressure, also called hypertension. High blood pressure puts extra strain on the artery walls, which can contribute to plaque buildup. High cholesterol levels, particularly high levels of LDL or bad cholesterol, are also significant risk factors. Cholesterol is a primary component of the plaque that clogs arteries. Smoking is another powerful risk factor. Chemicals in tobacco smoke damage the lining of the arteries and accelerate the buildup of plaque. Diabetes, a condition where blood sugar levels are too high, also significantly increases the risk of developing CAD and its complications. Being overweight or obese increases the risk of CAD. Excess weight can contribute to high blood pressure, high cholesterol, and diabetes. A family history of heart disease, meaning close relatives like parents or siblings have had heart problems, also increases your risk. This suggests a genetic predisposition. Finally, leading a sedentary lifestyle, meaning not getting enough physical activity, is a risk factor. Regular exercise helps maintain a healthy weight, blood pressure, and cholesterol levels. Many of these risk factors are interconnected. Making healthy lifestyle choices plays a very significant role in reducing your risk of developing CAD. The good news is that coronary artery disease is often preventable. Even if you have risk factors or already have CAD, it is often treatable. Taking proactive steps can significantly reduce your risk or manage the condition effectively. Lifestyle changes are a cornerstone of both preventing and treating CAD. Eating a heart-healthy diet is crucial. This means focusing on fruits, vegetables, whole grains, lean proteins, and healthy fats, while limiting saturated and trans fats, cholesterol, sodium, and added sugars. Exercising regularly is also vital. Aim for at least 150 minutes of moderate-intensity aerobic exercise per week. Physical activity helps improve cholesterol levels, lower blood pressure, manage weight, and strengthen the heart muscle. If you smoke, quitting is one of the most impactful steps you can take for your heart health. Smoking cessation dramatically reduces the risk of CAD and heart attack. Managing stress effectively through techniques like meditation, yoga, or hobbies can also benefit your heart. In addition to lifestyle changes, medications are often used to manage CAD and its risk factors. Statins are commonly prescribed to lower high cholesterol levels. Blood thinners, such as aspirin or other anticoagulants, may be used to help prevent blood clots from forming in the arteries. Other medications can help control blood pressure, manage diabetes, or relieve angina symptoms. In more severe cases, or when blockages are significant, medical procedures may be necessary to restore blood flow. Angioplasty is a common procedure where a thin tube with a balloon is inserted into the blocked artery. The balloon is inflated to push the plaque against the artery wall and open it up. Often, a small mesh tube called a stent is left in place to keep the artery open. Another procedure is bypass surgery. This involves using a healthy blood vessel from another part of the body to create a new pathway for blood to flow around a blocked section of a coronary artery. These treatments help improve blood flow to the heart muscle. Understanding coronary artery disease is incredibly important for everyone. It's not just a condition that affects older people. It can begin to develop earlier in life. Knowing what CAD is helps you appreciate the potential risks to your heart health. Recognizing the risk factors for CAD is also essential. By identifying which risk factors apply to you, you can take targeted action to reduce your personal risk. This might involve making changes to your diet, increasing your physical activity, or working with your doctor to manage conditions like high blood pressure or diabetes. Taking proactive steps based on this understanding is key to protecting your heart. Simple changes in daily habits can have a profound impact over time. Being informed empowers you to make healthier choices and discuss your risks and concerns with your healthcare provider. Ultimately, understanding CAD is essential for maintaining good health and quality of life. It helps you recognize potential symptoms like angina and know when to seek medical help. It also helps you understand the importance of following treatment plans if you are diagnosed with the condition. By understanding CAD, its causes, symptoms, and how to prevent or manage it, you are taking control of your heart health. This knowledge is a powerful tool in preventing serious complications like heart attacks and living a longer, healthier life.